My name is Josh, and welcome to End Your Knee Pain Forever, a video presentation to help you take care of your own knee pain. We're going to talk about my background and the types of knee pain that I've observed and treated, the functional anatomy of the knee, and a treatment plan for undiagnosed knee pain. So I haven't seen you, or you may not know exactly why you're having knee pain, but we'll get into the ins and outs of that. And at the end, I'll give you my contact info so that you can ask me questions, and of course I'll have a disclaimer about what you may experience when using this information, of course. But let's get started. Okay, I've been in the physical training and the physical fitness industry for about 10 years in the United States Army, and then as a civilian here in Portland, Oregon. I'm currently a personal trainer in Portland, Oregon, and I've discovered that knee pain is mysterious, misunderstood, and misdiagnosed, often, very often, in my experience. And that led me to want to help people with this presentation. So I've had climbers, cyclists, and runners come in to my practice with knee pain, and they've been evaluated by physicians and physical therapists, and they've been prescribed things like static stretching, quad strengthening, squats, and oftentimes it just makes the pain worse or does nothing. And strengthening the quads to stabilize the knee is not a terrible idea, but I speculate that if you're a climber and you can go up a mountain with a 50-pound pack, you can do a century or half marathon or whatever, your quads are probably pretty strong. And what we have is a problem of imbalance, not strength, that leads to knee pain. And that's an approach that, for some reason, conventional medicine just doesn't seem to want to embrace. And fortunately for you, it's actually pretty easy to bring your body back into balance. Okay, so if you're presenting with knee pain, there's a lot that can go wrong with the knee. There's lots of ligaments, muscles, tendons, bones, connective tissue, things. But basically, there are two major kinds of pain that I see over and over again. And this is what they'll look like in your life. And this is from the MayoClinic.com, pretty reliable source. The big thing that I see a lot of is chondromalacia, or patellofemoral syndrome. And according to the Mayo Clinic, you will notice pain walking up and down stairs when you kneel or squat, or when you're sitting with a bent knee for long periods of time. An example of this in my life was I used to have terrible knee pain, and it would be a nightmare for me to sit on a plane because you're basically stuck in a seat for hours on end, and it's without the inability to kind of move and relax that tissue in the leg, it's very painful. And another syndrome that many people present with is patellotendinitis, which is more general, but initially it's present only as you begin a physical activity or just after an intense workout, and then it progresses to interfere with all athletics, and then eventually daily tasks is just climbing stairs or getting up from a chair. And notice how the symptoms overlap in these two syndromes, and that's significant in that the problems are quite similar. In fact, a muscle imbalance that leads to patellofemoral syndrome can easily lead to patellotendinitis. So your symptoms could easily overlap and become kind of two different problems. But let's get into this. So patellotendinitis is basically just inflammation of the common quad tendon and or the patella ligament. So the quadriceps, the muscles of the thigh, connect at the common quad tendon, which connects to the patella, shown here. And the patella ligament is simply the piece of tissue that connects the kneecap there, the patella, with the tibial tuberosity, right here. So inadequate repair of this tissue, overuse or rigidity of the quad muscles leads to inflammation. Just pain, sometimes swelling, but definitely pain. And our goal in patella tendonitis is to just reduce the connective tissue load, which is a lot easier than it sounds. But we'll do that by retraining the hip extensor mechanism, strengthening the leg musculature, and really balancing the length tension of the leg in general, and especially in and around the knee, which is kind of the key to everything. And then tissue quality, which is removing adhesions or knots that build up in the muscle and fascia. And if you want to think about why that's important, think about a rope. So imagine that this quadricep is a rope. If you tie a knot in a rope, you actually can't use the rope shortens effectively, right? You can't use as much length of the rope. Well, that's what happens if you knot up your tissue in the muscle fibers. If you create adhesions, you effectively shorten the amount that you can use, and you increase and you keep tension on this common tendon here and the ligament of the knee. So removing those adhesions and quote unquote lengthening the rope is key to relieving the symptoms of patella tendonitis. Patellofemoral syndrome is a little bit more complicated, but not terribly so. This is more of what I call a tracking issue, and the misalignment of the patellofemoral joint can be kind of predicted by an increased Q angle. A Q angle is the angle at which your femur leaves the hip joint and connects with the patellofemoral joint. So it's basically the steepness of this angle right here, and this is a female, lower body image here, and you can see that just because of the nature of a female hip, you're going to have kind of genetically a larger Q angle. Males have a tendency to have a more upright and straight Q angle than women do. Being knock-kneed during movements, whenever you see a cyclist, or if you're a cyclist who, when you pedal, your knee comes in and nicks the top tube of your bike, that's a great indicator for somebody who has a tracking problem, or at the very least a high Q angle. In somebody who has patellofemoral syndrome will experience pain when running, biking. The goal is to use the hip to stabilize the knee, to reduce friction. One of my clients who had patellofemoral syndrome said that it felt like there was gravel in their knee whenever they were moving. And that means, it's a classic sign of a tracking problem where the joint mechanics are such that the load does not distribute well and evenly in the knee, and you have a grinding of the meniscus, or some bone-on-bone friction there, which is not good. The solution to that is, of course, retraining the lateral fibers of the glute max and the lateral rotators in the hip complex, and all that is these muscles here, training them to kind of pull that femur away from the other femur, away from the midline of the body during movements, so that the knee tracks a little more neutrally. You'd like to have an 11 to 22 degree Q angle. That's within normal limits according to the literature. You can't tremendously affect the Q angle. You're kind of born with what you've got, but you can modify it slightly, and you want to modify it in your favor so that your body trends towards stability over time, not instability. So we're retraining the lateral fibers of the glute max and the lateral rotator and hip complex, strengthening the leg musculature, balancing length tension relationships, and then of course removing adhesions in muscle and fascia. And that should sound familiar because that's kind of solving muscle imbalance problems, and that's the grandfather of both of these syndromes. So a little more detail on the knee from two different perspectives here. Patellofemoral syndrome, or the grinding pain when moving, which I call a tracking problem, is the knee means the knee is unstable in the transverse plane or left to right. So actually, this is a nice neutral Q angle here. And if your knee isn't stable left to right, if your knees are you're bow-legged or knock-kneed, you're at higher risk for kind of patellofemoral syndrome. And then an ache or pain when sitting in a chair going downstairs is the tension of the various quads and the patellar ligament. Again, just the overuse and tension on the front of the leg, just bringing inflammation and not allowing this connective tissue here to recover from stress, which causes pain. So both of these syndromes are a result of muscle imbalance, and the old school conventional method of doing a hamstring stretch is not going to cut it. Not to mention other problems that can result from these muscle imbalances, like IT band syndrome or overpronation injuries or supination injuries. But let's keep rolling. So, and balance is so important because the tension in one muscle affects the quality of muscles in a joint system. Some muscles have a tendency to become overactive even without us being aware of them. Other muscles have a tendency to become underactive unless we choose to utilize them. So think about this. A lot of people present quad dominance. So the rectus femoris is a hip flexor muscle that attaches up here at the hip, and it crosses the hip and it comes down and it attaches at the knee or just below the knee. And the rec fem it's tonic. It has a tendency to become overactive even if you're not actually doing a lot of sports. We rely on our strong muscles to do everything. If you're not bringing energy into muscles that we don't use that often, like the hamstrings and glutes, we tend to rely on the quads, and they get stronger. And as we sit, they get shorter because if you shorten a muscle just through posture and position, it'll tend to want to stay short, and that shortening overused muscle there will eventually bring a lot of tension into this joint system, in this case the knee, and it will not be balanced out by the hamstrings and the glutes. And how did the hamstring and the glutes affect the knee? Well, the quad's attached to the front of the pelvis, glutes and hamstrings attached to the back. So if you strengthen the glutes and the hamstrings, they will resist, they will pull back, and they will kind of automatically stretch that quadricep and force it to lengthen. And in lengthening it, you can reduce the tension on the patellofemoral joint and solve some of these syndromes, some of this knee pain that a lot of people present with. So the mouthful. But I'm going to get back to the slide now. Okay, just by activating or gently contracting a muscle with a relatively minor amount of tension, we can restore function to underused muscles and facilitate balance. Yeah, that's what I just said. Once a muscle is more conditioned, it will naturally stretch its antagonist tissue, greatly reducing the need for old school static stretching. Couldn't have said it better myself. A smart man wrote this. Okay. Stretching is still useful for some things, but not generally for curing knee pain. So I'm always leery when I see a physical therapist workup that suggests a lot of static stretching, because it's just more effective to use more dynamic movement to solve muscle imbalance. And I think that's all we need for this slide. Let's go on. One of my trainers I work with, said it's not fair to show this pair of glutes together, but I think that this is a great example of what happens when you are mindfully putting energy into your body and using muscles that if we stay asleep, if we let stay asleep, kind of fall into ruin. Here's a heart-shaped glute of somebody who's not doing a lot of conditioning or training, and does not have strong and stable hips, knees, and low back. And this is a upside down heart, which is the kind of form that you want to see your glutes take when you're properly utilizing them. A strong glutes and hip complex stabilize the knee and the low back, and also happen to look a lot better. So this is the consequence of inaction. Don't be like our perpetrator here on the left. You don't have to be a gymnast by any means, but just use your body, and it wants to be strong. Okay. All right, enough fun. We're talking about the treatment plan now. All right, so accompanying this video on this YouTube channel or on my website, I've posted a series called of knee pain videos, and these are all exercises that, if you follow this prescription every single day, you're not going to overtrain or do any kind of damage if you do these motions every day. They're very subtle. They might be surprisingly difficult if you haven't been doing a lot of exercise, or even if you are a pretty active person. I know of when I give this to cyclists and people who do one kind of movement repetitively, this can be surprisingly difficult. But basically, all we're doing is activating our glutes, our hamstrings, our glutes again, removing adhesions with the foam roller, and then mobilizing our glutes and hamstrings with a lacrosse ball, and then doing squats as long as you have no pain, in order to strengthen the overall leg musculature, because squats are pretty useful. So follow the instructions in the video. There's demonstrations and descriptions, and this should alleviate 80% of knee problems. And again, the links are on my website and my YouTube channel. So here's the disclaimer. This is a shotgun approach. I haven't evaluated you. I don't actually know what's going on with your body. If you try these and it doesn't help after 21 days, it probably is not going to help, or you're not doing them right. Either way, what you're doing is not going to work. So stop after 21 days if this does not help. And of course, if you feel pain from these exercises, do not perform them. Talk to your doctor. Talk to a good physical therapist if you need recommendations. You can come see me. You can email me at josh@pdxtraining.com. I will give you names of some good people in your town if you're not in Portland. If you're in Portland, I can give you many more names. And you can get further videos and, of course, all the free information off my blog at www.pdxtraining.com. All right, go out there, solve your knee pain, get back on the road, and let me know if you have any problems or hiccups along the way. Thank you.